Right. So I think one of the things, because CLL is a relatively rare cancer compared to, really well established communities for breast cancer or, even colon cancer and others cancers. Um, there's tremendous solace for patients in seeing other patients. When people meet people like me, who's a 15-year survivor, and not with a gentle form of CLL, but a very aggressive form of CLL, having met with me and seeing me, or with some of the other people in a group who are 17 years out, 20 years out, that says something to them that no doctor can ever say. If they can look in the eye of another patient and says, "Yeah, I was diagnosed 20 years ago, scared to death, and now it's 20 years later, and I've seen, my kids grow up and give me grandchildren and this kind of stuff." It's a tremendous message. And we don't want that messaging to stop just because we can't socially get together. So we think it's even more important now because people are feeling isolated, and that there's a lot of tips people can give about where can I get, a mask, what's going on here. Just even I've attended a number of these groups, and people have said, well, so and so will deliver the groceries to you, because it's a local group, and the group in Seattle can give tips to somebody else in Seattle saying, well, have you tried so and so? They're still got this supply or that. It's been a tremendous resource for people beyond their normal family. And the other thing that's been amazingly cool about this is that people in smaller communities where they wouldn't be able to put together a support group have called into some of the centers where it might be 100 miles away, and then we're going to drive in, but now they're right there in the same virtual room with everybody else. So people from smaller communities are able to join some of the established communities, some of the bigger communities, so they can realize that they're not alone. For some people, these virtual groups are the first time they've ever seen another CLL patient, especially people in small, more rural communities. So we think it's critically important to keep this going. And that's the feedback we're getting from patients, that they're extraordinarily grateful for it. And bluntly, a lot of them like it because they don't have to drive in the traffic. I live in the Los Angeles area. It can be 2 hours to get to one of our meetings. So people like the fact that they can just get on their laptop, type, 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 and they're in. So